test I'll be performing now is called the posterior glide at 90 degrees, the jerk test, and the posterior glide at 0 degrees. So the first one, what I'm going to do is I'm going to bring the patient here into 90 degrees of shoulder flexion, 90 degrees of elbow flexion. And what I'm going to do is I'm going to palpate for one hand on the posterior side of the glenohumeral joint, and I'm going to apply a posterior translation here through the distal humerus. Then I'm going to apply an axial compression, and I'm going to adduct his arm across his body. And what I'm looking to see is if I notice a jerk, which would indicate a subluxation potentially of the glenohumeral joint. And as I'm applying this jerk, I'm feeling for that. As I'm applying this pressure, I'm feeling for that jerk. Then I'm bringing it back and relocating it into normal position, and also seeing if there's a slight jerk during the relocation process. Then I'm going to bring the arm out into 90 degrees of shoulder abduction here, and then I'm going to palpate on the posterior side, and I'm going to apply a posterior translation with my other hand. Now, in the first position and this last position, if I'm noticing any pain, apprehension, or clicking, that could all be due to posterior shoulder instability.